8 silent stroke warning signs you should never ignore. A stroke does not always look like a stroke. No collapse, no dramatic fall, no ambulance lights. Sometimes it happens so quietly that the person it happens to never even notices until a routine scan, months or even years later, reveals it was there all along. This video is for general educational purposes only and is not intended to diagnose any medical condition or replace advice from a qualified healthcare professional. If you or someone you know is experiencing any of the symptoms we are about to describe, please seek medical attention right away. Over the next few minutes, we are going to walk through 8 signs that researchers and physicians associate with what is often called a silent stroke, along with several warning signs that can appear before a larger stroke ever takes place. Some of these signs are so subtle that they get brushed aside as stress, tiredness, or simply getting older, which is exactly why so many people miss them completely. And there is one sign near the end of this list that many neurologists consider the single most overlooked warning of all, one that can appear weeks before a major event and is almost always dismissed as nothing. So if you have ever felt a strange flicker in your vision, a moment of confusion that passed too quickly to worry about, or a wave of fatigue that did not seem to match your day, stay with us. Because by the end of this video, you may never look at those small moments the same way again. Let us start with what a silent stroke actually is in plain language. A stroke happens when blood flow to part of the brain is interrupted, either because a blood vessel is blocked or because it ruptures. Most people associate this with sudden, obvious symptoms, someone collapsing, one side of the face drooping, and inability to speak at all. But researchers have found that a large number of strokes produce no noticeable symptoms at all, or symptoms so mild that they pass within minutes and are forgotten entirely. These are sometimes called silent strokes, and they can quietly damage brain tissue over time, even though the person never realized anything happened. What makes silent strokes especially difficult to catch is that they often show up only on brain imaging done for a completely different reason, sometimes years after the fact. A person might go in for a scan related to a headache, a fall, or a routine checkup, and the imaging reveals small areas of damage that the person never knew existed. Doctors sometimes describe these findings almost in passing, mentioning that there is evidence of prior small strokes, and the patient is left stunned, wondering how something like that could have happened without them noticing. This is exactly why paying attention to the subtle, easily dismissed moments in daily life matters so much. The brain does not always announce an injury with pain the way a broken bone does. Sometimes it whispers through a flicker of confusion, a strange wave of fatigue, or a moment of clumsiness that disappears almost as quickly as it arrives. Now let us walk through the signs, one by one, starting with something many people experience and almost never connect to brain health. Number 1, sudden unexplained confusion or memory slips. There is a particular kind of confusion that feels different from ordinary forgetfulness. It is not misplacing your keys or blanking on a word every now and then. It is a sudden moment where familiar surroundings feel unfamiliar, where a simple task like making coffee suddenly feels confusing, or where you lose track of a conversation you were fully engaged in seconds earlier. Physicians sometimes describe this as a brief cognitive fog that clears up almost as quickly as it appeared, which is exactly why it tends to be dismissed. Consider Martha, a retired schoolteacher in her early 70s. One afternoon while paying bills, she suddenly could not remember how to write a check, even though she had done it thousands of times before. The feeling passed within a couple of minutes, and she chalked it up to being tired. She did not mention it to anyone, not even her daughter, because it seemed too minor to bring up. It was only months later, during a routine scan for an unrelated issue, that her doctor noticed small areas of damage in her brain consistent with earlier silent strokes. Stories like this are part of why researchers emphasize that sudden confusion, even brief confusion, may be associated with reduced blood flow to the brain and could be worth discussing with a healthcare professional, especially if it happens more than once. It is worth noting that confusion on its own is not automatically a cause for alarm. People experience brain fog for countless ordinary reasons, including dehydration, low blood sugar, poor sleep, certain medications, and simple overstimulation. The distinction physicians tend to focus on is the suddenness of the onset and how out of character it feels compared to a person's normal mental clarity. A gradual decline in memory over years is a very different pattern from a sudden, sharp moment of disorientation that appears out of nowhere and then lifts. Recognizing that difference is often the first step toward taking these episodes seriously rather than writing them off as an ordinary bad day. Number 2, unusual fatigue that does not match your day. Everyone gets tired, but there is a specific kind of fatigue that some researchers link to changes in brain blood flow, and it tends to feel different from ordinary exhaustion. It often arrives suddenly in the middle of a normal task without the buildup of a long day or poor sleep. Some people describe it as their bodies suddenly feeling heavy, as though gravity increased for a few minutes. Others describe an overwhelming urge to sit down immediately, even in the middle of a conversation or a walk they were enjoying. This type of fatigue can be easy to explain away, especially for people managing busy schedules, caregiving responsibilities, or physically demanding jobs. And most of the time, tiredness truly is just tiredness. However, when unusual fatigue appears suddenly, repeatedly, and without an obvious cause such as poor sleep or physical exertion, it may be worth mentioning to a doctor, particularly if it occurs alongside any of the other signs in this video. The key difference researchers point to is not the tiredness itself, but the suddenness and the mismatch between how a person feels and what they were actually doing at the time. There is also a secondary pattern worth mentioning, one where this kind of fatigue is paired with a subtle change in motivation or alertness, almost as though a mental fog has settled in alongside the physical heaviness. Family members sometimes describe noticing a loved one suddenly seem far away or distant for a short stretch of time, only for that person to return to their usual self shortly afterward. Because fatigue is such a universal experience, and because so many entirely benign conditions can cause it, this sign is rarely taken seriously on its own. Physicians generally suggest paying closer attention when sudden fatigue becomes a repeating pattern rather than a rare, one-time event. Number 3, brief vision changes that come and go. Vision disturbances are one of the more commonly reported early signs associated with reduced blood flow to the brain, yet they are often mistaken for normal eye strain or aging vision. These episodes might include a curtain-like shadow passing briefly over one eye, sudden blurriness in part of the visual field, or a temporary loss of vision that resolves within a few minutes. What makes this sign particularly easy to overlook is its brevity. A person might blink, rub their eyes, and continue with their day, assuming it was simply fatigue or too much time spent looking at a screen. James, a 68-year-old retired truck driver, described one such episode to his family only after a much more serious event landed him in the hospital. He recalled that a few weeks earlier, while reading the newspaper, the words on the right side of the page seemed to disappear for about a minute before returning to normal. He never told anyone, assuming it was nothing more than eye fatigue. Sudden temporary vision changes, even ones that resolve quickly, may indicate a disruption in blood flow to the brain and are generally considered worth discussing with an eye doctor or physician, especially when they occur more than once. Vision-related signs can be particularly tricky to identify because so much of what happens involves only one eye or one side of the visual field, and the brain is remarkably good at compensating in the moment. A person might not even consciously register that half of a page briefly vanished, especially if they were reading quickly or thinking about something else entirely. This is one of the reasons eye doctors sometimes catch early warning signs of vascular problems during routine exams, noticing changes in the blood vessels at the back of the eye that can offer clues about circulation elsewhere in the body, including the brain. Number 4, slight slurring or changes in speech rhythm. Most people are familiar with the idea that slurred speech can be a sign of a major stroke. But there is a subtler version of this that tends to fly under the radar entirely, one where speech becomes slightly slower, slightly less fluent, or oddly rhythmic for just a few sentences before returning completely to normal. Family members sometimes notice it before the person experiencing it does, often describing it as the person sounding briefly tired or distracted while speaking. This kind of subtle speech change can be especially tricky because it often happens during ordinary conversation, and the person speaking may not even notice anything different about how they sound. A spouse might say something like, "You sounded a little strange for a second there, are you feeling all right?" only to be told that everything is fine. These brief, almost imperceptible shifts in speech pattern may be associated with temporary changes in blood flow to the parts of the brain responsible for language. And researchers suggest that noticing this pattern, especially if it happens repeatedly, is worth bringing up with a healthcare provider. Linda, a 62-year-old accountant, recalled an odd moment during a family dinner when she paused mid-sentence, searching for a word that should have come easily, something as simple as the word refrigerator. It took her several seconds to find it, and when she finally did, she laughed it off, blaming a long week at work. Her husband noticed the pause but did not think much of it either, since everyone occasionally loses a word here and there. It was not until a follow-up conversation with her physician, prompted by an entirely unrelated visit, that she mentioned the moment almost as an afterthought. Her doctor took it seriously enough to recommend further evaluation, a reminder that these small, easily forgotten moments sometimes carry more meaning than they first appear to. Number 5's numbness or tingling that fades quickly. A brief tingling sensation in the hand, arm, or one side of the face is often blamed on sitting in an odd position or sleeping on an arm the wrong way. And in many cases, that explanation is perfectly reasonable. However, when numbness or tingling appears suddenly, affects one side of the body more than the other, and fades within a short period of time without an obvious physical cause, it falls into a category that neurologists pay closer attention to. What separates this from ordinary numbness is the pattern. Ordinary numbness from sitting awkwardly usually comes with an obvious physical explanation and often affects an entire limb evenly. The type of numbness associated with reduced blood flow to the brain tends to appear more suddenly, often on just one side of the face, one arm, or one leg, and can occur even when the body was not in any unusual position beforehand. If this kind of numbness happens without explanation, especially alongside any of the other signs mentioned so far, it may be helpful to seek a medical evaluation rather than assuming it will resolve on its own. One detail physicians often highlight is how this numbness tends to follow a one-sided pattern, affecting the left or right side of the body rather than both sides evenly. This one-sidedness is significant because it reflects how the brain is organized, with each half generally controlling sensation and movement on the opposite side of the body. A brief episode of numbness confined to one side, especially involving the face, hand, or leg together, tends to raise more concern among physicians than numbness that appears more generally or that comes with an obvious explanation, such as an arm that has simply fallen asleep from being slept on. Number 6, sudden difficulty with balance or coordination. A momentary stumble while walking across a flat, familiar floor, a cup that slips from the hand for no clear reason, a brief sensation of the room tilting even while standing perfectly still. These small, easily dismissed moments of imbalance are sometimes associated with disruptions in the areas of the brain responsible for coordination and spatial awareness. Robert, a 74-year-old retired carpenter known for his steady hands, mentioned to his son almost as a joke that he had dropped his coffee mug 3 times in 1 month, something that had never happened before in his life. He laughed it off as clumsiness that comes with age. It was only after a fall a few weeks later that doctors discovered evidence of earlier small strokes that had gone completely unnoticed. Sudden, unexplained coordination problems, particularly when they represent a clear change from a person's normal abilities, may be worth discussing with a healthcare professional rather than attributing entirely to normal aging. Balance issues are especially easy to explain away because so many other factors influence coordination as people get older, including joint pain, inner ear changes, medication side effects, and simple muscle weakness. What tends to stand out to physicians is not an occasional stumble, which happens to almost everyone from time to time, but a noticeable and sudden shift in a person's baseline coordination, especially when that person previously had no history of balance problems at all. A once steady hand that suddenly and repeatedly fumbles familiar objects is often more telling than a single isolated incident. Number 7, unexplained headaches with a different feel. Headaches are common, and most of them have nothing to do with stroke risk. However, there is a specific pattern that researchers highlight as worth paying attention to. A headache that feels noticeably different from a person's usual headaches, arrives suddenly, and may be accompanied by any of the other signs discussed in this video. This is not about ordinary tension headaches or familiar migraines. It is about a new kind of head pain that feels unusual in intensity, location, or sensation compared to what a person normally experiences. Some people describe it as a sudden pressure rather than a typical ache, or a sharp sensation localized to one specific area rather than the more general discomfort of a tension headache. Because headaches are such a universal human experience, this sign is particularly easy to overlook, especially in people who already deal with chronic migraines or frequent tension headaches. The distinguishing factor researchers point to is not the presence of a headache itself, but its sudden onset and its unfamiliar quality compared to a person's usual pattern. Doctors sometimes refer to this as the worst headache of my life pattern, though that phrase can be misleading, since not every concerning headache reaches that level of intensity. What matters more is the combination of suddenness and unfamiliarity. A headache that reaches its peak intensity within seconds to minutes, rather than building gradually over hours, tends to draw more clinical attention, especially in someone who does not have a prior history of sudden, severe headaches. When this type of headache appears alongside any of the other signs discussed in this video, such as vision changes, numbness, or confusion, it is generally considered a combination worth evaluating promptly. Number 8, a brief episode that looks exactly like a small stroke and then fully disappears. This is the sign we mentioned earlier, the one many neurologists consider among the most overlooked of all. It is sometimes referred to in medical literature as a transient ischemic attack, often shortened to TIA, which many people informally call a mini-stroke. During one of these episodes, a person may experience any combination of the signs already covered in this video: sudden confusion, slurred speech, numbness on one side of the body, or vision changes. But then, within minutes to about an hour, everything returns completely to normal. This complete recovery is exactly what makes this sign so dangerous to ignore. Because the symptoms vanish entirely, it is remarkably common for people to convince themselves that nothing serious happened at all. Diane, a 66-year-old retired nurse who had spent decades working in emergency medicine and who understood stroke symptoms better than most people ever will, experienced a sudden weakness on the left side of her body while gardening. It lasted about 20 minutes and then disappeared completely. Even with her professional background, she told herself it was probably just a pinched nerve from bending over too long, and she went back to planting flowers. 3 weeks later, she experienced a significant stroke that led to a lasting impact on her daily life. Research has consistently shown that a meaningful percentage of people who experience one of these brief, fully resolving episodes go on to have a more serious stroke within the following days or weeks, which is exactly why medical professionals consider any brief episode resembling stroke symptoms, even one that fully resolves, a signal that deserves immediate medical evaluation rather than relief that it went away. There is a simple way many healthcare providers encourage people to remember the most urgent version of these signs, using the acronym FAST, which stands for face, arms, speech, and time. If one side of the face droops, if one arm drifts downward when both arms are raised, if speech becomes slurred or strange, it is time to call emergency services immediately, even if the symptoms already seem to be fading. This acronym was designed specifically because so many people hesitate during these moments, waiting to see if symptoms will pass on their own, and that hesitation can matter a great deal when it comes to preserving brain function. Bringing all of this together, the theme running through every sign we have discussed is the same. Silent strokes and the warning signs that sometimes come before larger strokes tend to whisper rather than shout. They show up as a moment of confusion that clears too quickly to worry about, a wave of fatigue that does not match the moment, a flicker in your vision, a stumble on a familiar floor, or an episode that resolves so completely that it feels like it never happened at all. And that is precisely why they get missed so often, not because people are not paying attention, but because these signs are quiet by nature and quiet things are easy to dismiss. Think back for a moment to the 8 signs we covered today: a flicker of confusion that clears too quickly to explain, a wave of fatigue that arrives out of nowhere, a brief shadow crossing the vision, a pause in speech that feels slightly off, a patch of numbness on one side of the body, a stumble on familiar ground, a headache that feels unlike any other, and an episode that mimics a stroke completely, only to vanish as though nothing happened at all. Individually, each of these can be explained away by something ordinary, and often that ordinary explanation is the correct one. But together, as a pattern, they represent exactly the kind of quiet signals that deserve a second look rather than quick dismissal. If there is one statistic worth remembering from everything we have covered today, it is this. A meaningful percentage of people who experience a brief, fully resolving episode that looks like a stroke go on to experience a more serious stroke within a short period of time afterward, which is why medical professionals consistently emphasize that even symptoms that disappear completely deserve prompt medical attention rather than relief. None of this is meant to cause alarm every time you feel tired or forget where you put your phone. Most moments of forgetfulness, tiredness, or clumsiness have completely ordinary explanations and have nothing to do with stroke risk. But now that you know the subtle patterns that researchers and physicians pay attention to, you are better equipped to notice when something feels genuinely different and to take that feeling seriously rather than brushing it aside. It is also worth remembering that certain factors can make these silent signs more likely to occur, including high blood pressure, high cholesterol, diabetes, smoking, and a family history of stroke or heart disease. None of these factors guarantee that a stroke will happen, and having none of them does not guarantee that it will not, but they are part of the broader picture that a healthcare provider can help evaluate. Regular checkups, especially for blood pressure and cholesterol, remain one of the most consistently recommended ways to catch developing risk factors before they lead to a larger event. If you have not had these numbers checked recently, this might be a good moment to schedule that appointment, not out of fear, but out of the same quiet attentiveness we have been talking about throughout this video. We would love to hear from you. Has anyone in your life experienced one of these subtle signs without realizing what it might have meant at the time? Share your story in the comments below, because your experience might be exactly what helps someone else recognize these signs in themselves or in someone they love. If you found this video helpful, please consider sharing it with a family member or friend who could benefit from knowing these signs. And if you would like to see more educational videos like this one, consider subscribing to our channel so you never miss an update. Thank you so much for watching, and we will see you in the next video.